When most people think about multiple sclerosis, they picture damage happening inside the brain and spinal cord. But what many don't realize is that the effects of MS are often felt most intensely in the musculoskeletal system, the muscles, joints, bones, tendons, and structures that allow the body to move. The nervous system and musculoskeletal system work together constantly like a perfectly coordinated team. The brain sends electrical signals through nerves, and the muscles respond by creating movement, balance, posture, and strength. But in multiple sclerosis, those communication signals become disrupted because the immune system attacks the protective myelin sheath surrounding nerve fibers. Once those nerve signals slow down or become distorted, the muscles no longer receive clear instructions from the brain. Over time, this creates weakness, stiffness, poor coordination, pain, muscle wasting, and severe mobility problems that can dramatically change a person's independence and quality of life. One of the earliest and most common musculoskeletal symptoms in MS is muscle weakness. This weakness can affect the arms, legs, core muscles, or even the muscles involved in posture and balance. Unlike normal tiredness after exercise, MS-related weakness happens because damaged nerves cannot properly activate muscles. Some patients describe the feeling as if their limbs suddenly become heavy or disconnected from the brain. Tasks that once felt automatic, climbing stairs, lifting objects, standing from a chair, or even walking short distances, may slowly become exhausting and difficult. Another major musculoskeletal problem in MS is spasticity, which refers to abnormal muscle tightness and stiffness caused by disrupted nerve signals. Normally, muscles contract and relax in a smooth, controlled way. But in MS, damaged nerve pathways interfere with this balance, causing muscles to remain constantly tight or suddenly contract involuntarily. Spasticity most commonly affects the legs, but it can also involve the arms, back, or neck. Patients may experience painful muscle cramps, rigid limbs, or difficulty moving joints freely. Severe spasticity can interfere with walking, sleep, hygiene, and daily activities. In some cases, muscles become so tight that joints lose their normal range of motion, leading to contractures where the limb becomes permanently stiff in one position. These complications can significantly reduce independence and increase caregiver burden over time. Balance and coordination problems are also closely tied to musculoskeletal dysfunction in MS. The cerebellum, spinal cord, and sensory nerves all help coordinate smooth movement and body positioning. When these pathways are damaged, patients may develop tremors, unsteady gait, poor coordination, and difficulty controlling precise movements. Walking may become slow, awkward, or unstable, increasing the risk of falls and injuries. Some individuals may need assistive devices such as canes, walkers, or wheelchairs to maintain safety and mobility. Falls become a major concern because weakened muscles and impaired reflexes reduce the body's ability to protect itself during sudden movements. Fractures, joint injuries, and bruising are common complications, especially in patients with severe mobility limitations or osteoporosis related to reduced activity and steroid use. Pain is another important musculoskeletal issue in multiple sclerosis and can come from several different sources. Remaining in the same position for prolonged periods can also increase muscle tension and joint discomfort. Chronic pain not only affects physical function, but also contributes to emotional stress, sleep disturbances, fatigue, and depression, creating a cycle that further worsens musculoskeletal health. Reduced mobility in MS creates another major problem: muscle deconditioning and bone loss. Muscles require regular movement and resistance to stay strong. When mobility decreases, muscles begin to weaken and shrink, a process known as muscle atrophy. At the same time, bones lose density because they are no longer exposed to normal weight-bearing activity. This increases the risk of osteoporosis and fractures, especially in patients who already use corticosteroids for MS treatment. Joint flexibility may also decline, making movements stiffer and more painful over time. The longer immobility continues, the harder it becomes to regain strength and physical function. This creates a dangerous downward spiral where weakness leads to inactivity, inactivity worsens weakness, and worsening weakness further limits independence. Fatigue also has a powerful impact on the musculoskeletal system in MS patients. MS fatigue is not ordinary tiredness. It is a deep neurological exhaustion that affects both the body and mind. Because muscles already receive inefficient nerve signals, they require more energy to perform even simple movements. Patients may feel physically drained after activities that would normally require very little effort. This fatigue can reduce motivation for exercise and movement, which further weakens muscles and cardiovascular endurance. Heat sensitivity can make this even worse. Many individuals with MS experience worsening weakness and fatigue when body temperature rises during exercise or hot weather, making physical activity more difficult despite its importance for maintaining musculoskeletal health. Medical treatment may also be necessary to control musculoskeletal symptoms. Medications such as baclofen, tizanidine, or muscle relaxants are often used to reduce spasticity and painful muscle spasms. Pain management may include anti-inflammatory medications, nerve pain medications, physical modalities, or therapeutic injections in severe cases. Proper nutrition, hydration, and vitamin D support are also important for maintaining muscle and bone health. In some patients, aquatic therapy becomes especially helpful because water reduces stress on joints while allowing safer movement and exercise. Exercise programs must often be carefully balanced to avoid overexertion and worsening fatigue. Emotional health is deeply connected to musculoskeletal function in MS. Losing mobility or physical independence can be emotionally devastating for many patients. Activities that once felt simple may suddenly require assistance, leading to frustration, embarrassment, anxiety, or depression. Some individuals begin withdrawing socially because movement becomes physically exhausting or emotionally stressful. Fear of falling may also cause patients to avoid physical activity altogether, which accelerates weakness and joint stiffness. Support from family, caregivers, therapists, and mental health professionals becomes extremely important in helping patients maintain motivation, confidence, and emotional resilience throughout disease progression. Caregivers also face major physical and emotional challenges when supporting individuals with severe musculoskeletal complications from MS. Assisting with transfers, mobility, bathing, dressing, and fall prevention can become physically demanding over time. Proper caregiver education about body mechanics, safe lifting techniques, and mobility assistance is essential to prevent injuries for both the patient and caregiver. Access to support systems, rehabilitation resources, and respite care can significantly reduce caregiver burnout and improve long-term care quality. Understanding how MS affects the musculoskeletal system is essential for preserving mobility, reducing disability, and helping patients maintain dignity and independence throughout the course of the disease.